we had my son's 3rd birthday celebration. We had the opportunity to have some family members, but at the same time, using the CDC recommendations of social distancing, we decided to use some virtual tools. Now you folks at home can do this as well. Simply, we just needed a laptop, a microphone, and some audio capabilities. Join us as we take you through today's virtual celebration. Some of the tools that you need. Step 1 is to download the Zoom app. Once you get registered, then you can plan the day, send out the invitation to all your friends and family, and then set up your laptop. Once your laptop is up and going, you come up with creative ways in order to celebrate together. One of the things that we wanted to do is that we wanted to sing happy birthday all together while my son was watching. I thought it turned out really good. It kept everybody safe, and we had a great time and shared some memories.
Hi, Big.
Okay, we gotta practice singing at the same time on this phone because I don't know how to do it. So we're gonna sing Jingle Bells, okay? Ready? 1, 2, 3.
Jingle.
Jingle bells. Jingle bells.
Ready?
Ready?
We're gonna do jingle bells or happy birthday?
Let's do it.
Happy birthday!
Happy birthday. Happy birthday to you. With candles.
Yay!
Happy birthday.
Love you guys.
We know that this pandemic has a toll, and as we come to the celebrations of the holidays, Thanksgiving, New Year's, as well as Christmas, we want to encourage those to maybe start your own virtual celebrations. There are some other ideas and some other topics, as well as some other activities that you can do while you're on a virtual celebration.
Okay, now blow your candle out.
Good day, everyone. Thank you for joining us for today's COVID update. I'd like to welcome you to our weekly report and hope that you find this beneficial and useful as you protect yourself and your family through this pandemic. I'd like to turn it over to Mona Zavante for her update.
All right, thank you, Tori. So I just have a few words. So good evening, Winnebago community. The past month has been very difficult for our community. We're all watching the surrounding areas surging with cases. The hospitals are at capacity most days. This is very concerning for us. So it's imperative that we wear our mask. If you see someone not wearing their mask, social distance from them. As we've been stating for the past 9 months, wearing a mask and social distance is our best defense against the virus. The virus does not care about who you are. It affects anyone and everyone. With the surge in the cases, what does this mean for us? This means that our patients that are suffering from anything, whether it be COVID to having other medical conditions, may be transferred to a further location. This also means that the ambulance may be tied up for some hours. So a routine that might have only taken 2 hours could take us now up to 5 hours because we're going to longer locations, further away. This means that if something happens, such as an injury, that the ambulance may not be around to help you. But you can help us by wearing your mask. And if someone doesn't have their mask on, get away from them. If a positive person is not wearing their mask, it won't matter. You have to stay away from them. So that's why it's so important to wear your mask. Every member of our community is precious and vital to the success of our nation. The 215 community members that have been affected by this virus, that is 215 people that we could have lost to this virus. Those 215 people are our children, our parents, our aunts and uncles, and we're all tied to one another. So when one suffers, we all suffer. We have lost loved ones to this virus, and we don't know how this virus will affect us long term, or even whether if we get this virus, what that means for us. So we continue to ask you to wear your mask and social distance. The message that we've been sending for the past 9 months has not changed. It is up to you to choose to respond to it. It's up to you to make that decision and that choice as a member of this community to heed and quit going to parties, quit going to places where they don't wear their masks. Our Winnebago Public Health Department has been doing our best to meet the needs of the families through various housing options, getting groceries and other deliveries. I know that sometimes we're not as fast as people want us to be, but when we get slammed with 30 families, that takes hours, especially to go shopping. So if you haven't received your items on your designated day, please check back in with your public health nurse. I also want to draw some attention to some of the information that we provide after we've had additional positive cases. So pay attention to the quarantine families. So for instance, if we report that we have 10 new cases and the quarantine families do not change, there can be several reasons for that. One, that people are in the same household. Two, they've already been identified as close contacts and are already in quarantine. Also, there have been many questions about the recovery and active cases in households, and this can change daily. There are many people recovering, and they've reached their 10 days, or their households have reached their 20 or their 14-day post-exposures, and therefore they've been removed from the active and placed in recovery. Recovered people are able to leave their homes, even before their household, that they could still be on quarantine. So I know we've had many questions about looking at shutting down areas. There are many factors that need to be taken into consideration. One is, do we have enough staff to cover that operation? Is our hospital able to meet the needs of the testing? And is the public health department able to perform their contact tracing within 24 hours? In the data that we're going to present today, you will be able to see where people believe that they have contracted the virus. And at this time, we're not seeing any clusters within our businesses or schools. And that's really a direct reflection of the mask mandate that is enforced. I know that we are all under a lot of stress. But really, if we treat everyone as if they're positive, what would you do? You would wear your mask. You wouldn't let them within that 6 feet of you. So please do that. Treat everyone as if they have it. We're moving into this holiday season, and it's getting harder to stay away from others. But if you are going to interact with others outside your household, wear your mask. Because you are not only making decisions for you and your household, you could be affecting many people. You're affecting our children, and they have sometimes no choice in this matter. We have been educating for the past 9 months, and there has been many changes, but it still comes down to wearing your mask and social distancing. So when you're making your decisions for yourself, please remember all the other ones that you could be impacting. Again, we're all linked to one another. And we're all trying to do our best to get through this horrible situation. So we'll start this week's presentation with our updates. So as of today, we have a total of 215 positive cases in Winnebago, with 193 recovered. We have tested 1,223 people in Winnebago. They were negative. The positivity rate is 18% within Winnebago. So what does that mean? This means that of all the Winnebago residents that have come to be tested, that 18% were positive. We currently have 19 active cases and 19 families in quarantine. I know that Laura will be also addressing this in her comments and on her slides, but if you're coming for a drive-up appointment, please make sure that you come on time and that you make sure that you do not get dropped off. Please do not come into the hospital, but wait at the check-in and check-in in that little building. And I'm sure Laura will update a little bit more on that. But looking at the ages, we can see that for our ages 20 to 29, we have a 31% have been positive, followed by 23% of our 0 to 19-year-olds, and then 30 to 39 years old are 17%. And then as you can see from the positive gender breakdown, there's rarely a little significance between female and male, with female being at 52%. See. So this next slide just indicates or shows the link between the contacts or an isolated contact. So this graph indicates that 110 have already been positive within their household or have had a close contact. So as you can see, the majority of our cases are coming from within the household. We've had 52 from social gatherings. And what does a social gathering mean? It means going to the bar, going to a casino that's not ours, going to tournaments and other areas. And then of course, family gatherings are those that congregate that are outside their particular household, but are families. And then we've had 7 that can be linked back to the meatpacking plants, and then 13 that we're still unsure about, and we're still investigating those from previous positives. So this slide just shows the cases over time. So this starts back in April when we had our first case. And as you can see, we've had peaks at the end of May, and then again in September, and then here again in November. So we wanted just to touch on a little bit about celebrating Thanksgiving. We want to make sure that people are celebrating Thanksgiving as safely as they can. And we prefer that you celebrate with members of your intermediate household. But if you do spend Thanksgiving with people outside the household, we want to encourage you to take safer celebration. Everyone should be wearing their mask, of course, that it now covers your nose and mouth. Try to stay 6 feet away from others that don't live inside your household. Wash your hands for at least 20 seconds. Keep hand sanitizer readily available. Also attending a gathering, these come directly from the Centers of Disease Control. So they would like you to bring your own food, drinks, plates, cups, and utensils. Of course, still wear your mask. Avoid going in and out of areas where food is being prepared or handled, such as in the kitchen. Use single-use options like salad dressing and condiment packets, and disposable items like food containers, plates, and utensils. And if you're hosting your own family gathering, you want to make sure that If you can, be able to do it outside. If not, limit the number of guests if you're celebrating inside, and try to have your windows open if at all possible. Try to inform your family guests of what is expected at your celebration. Clean and disinfect frequently touched items. Limit the number of people in your food preparation areas. Have guests bring their own food and drink. And if you're sharing food, try to have single-use options like plastic utensils. And I believe that Laura has some updates on behalf of the 12 Clans Unity Hospital. So I thank you and be safe.
All right, thank you, Mona. One of the things I wanted to bring up that Mona showed was the graph that has the peaks. And if you look at where the peaks are, you can tell that they're after a holiday. So there's Memorial Day in May, and then we have a peak, a couple weeks after. Then there's the 4th of July, and we have a peak a couple weeks after. Then we have Labor Day, and we have a peak a couple weeks after. So we're already at the peak right now of those. And what are we going to see after Thanksgiving? And that's what we're really worried about. And we're very worried about the hospital system being overwhelmed, and it is getting overwhelmed. We did a really great job in March and thereon, making sure that people didn't come into the emergency department unless they were sick and needed emergency care. We did a good job of people staying out of the hospital so that everybody was safe unless they needed to be there to be seen, and only bringing a visitor in or bringing no visitors in, which would even be better. Just coming and getting your care and going home. So we've got to realize that we are being overwhelmed. And I'll just give you a story of a patient we had not that long ago that we needed to get transferred, and we called 13 hospitals to try and get the patient transferred because they needed a higher level of care than what we could give. And we finally got that patient where they needed to be, but it took us a long time and it was very scary for a while. So we need you to listen to what Mona is saying. We need you to help us here. We need you to be where we were at in March when everybody was just very good about and diligent about helping us not overwhelm the healthcare system. That's where we need to go back to. So I'm going to go over some things today about that and how you guys can help us and how we can help you too. So for testing at 12 Clans, we've had a lot of people come to the emergency room and just want testing. When some people show up with 5 or 6 people into the emergency room and they don't have symptoms, they just want to be tested, we have to go through a lot of things to get people into the emergency room. And then we have to do certain regulatory things in order to make sure that we get people the care they need. But if they're only coming in to get tested and they don't have any symptoms, that really bogs up our emergency room. It makes it hard for other patients to get seen. And yesterday we were at the point of putting patients in the hallway in our emergency department. So, and we had quite a few people that were in the emergency room that probably could have waited or went to the clinic at some point to see their primary care provider. And so we had to move people around, and some people had to wait. And we don't like that, but we were overwhelmed yesterday. So just kind of giving you some ideas of what we're seeing. So if you do need to get tested and you need to come to the emergency department, we want patients having symptoms such as trouble breathing, persistent pain or pressure in the chest, any new confusion, inability to wake or stay awake, bluish lips or face. You should come to the emergency room, of course, immediately. And we will go ahead and we'll get you tested and we'll get you cared for. We ask that asymptomatic people, the people that don't have symptoms, do not come to the emergency room for testing. This ensures that the emergency room staff and their resources are being allocated to the community members needing immediate and critical attention. This policy helps ensure the emergency medical attention is available for you, your family, your friends, and your loved ones when needed. We have testing available, but I'm going to go over it, how you can do it. If you're not symptomatic and you don't think you need emergency care, you can come to the outpatient department through the drive-through testing to get that done, or some courtesy testing. So patients who do not need emergency care and are having mild or no symptoms should utilize testing through the outpatient clinic. COVID-19 testing is done by appointment only. A testing appointment can be made by calling the outpatient clinic at 402-878-3404. Patients who have had COVID-19 exposure should not get tested until 5 to 7 days after the initial exposure. So we've had people say, oh, I was just exposed yesterday. Well, getting tested tomorrow or that day is not going to tell you anything. So you got to remember that when you go to get tested, it really needs to be 5 to 7 days after you've been exposed. Otherwise, we may not pick up the virus and you'll be walking around thinking you're negative, but you're not negative. Again, that's the reason to be wearing the masks too. Please allow at least 24 hours for test results. We have patients call within 20 minutes wanting their test results. And we're testing 50 to 60 people a day right now. I think we tested 54 the other day. Yes, it's supposed to be rapid, but it takes us time to get all of that done. And so give us 24 hours to get that test to you. Patients should self-isolate, rest, drink plenty of fluids, and use over-the-counter medications as needed to help with their symptoms. So this is what happens after you're tested through the drive up at 12 Clans. Your primary care provider or nurse from the outpatient department will contact you with your results. If you haven't heard after, and it's been 24 hours, then give us a call. You will be contacted within 24 hours of collection of your COVID-19 specimen. If we need to send your specimen out to another laboratory, sometimes we may have to do that. For example, maybe we've ran out of the rapid tests or equipment is not working. The results might take as long as 72 hours, but we'll let you know that. Continue to follow self-isolation or quarantine instructions until you receive your test results. Make sure we have the correct phone number so we can contact you. If we don't have an updated phone number, we can't get a hold of you, so we need that. You can leave your email address with us so that we can send you your results securely, and we can give you instructions on how to do that. That will avoid you from having to come back to the hospital again, and then it will also keep people, traffic out of the hospital. If you will need a written copy of your results, because I know some people do for their job or other things, contact the Health Information Management or medical records after you receive your results from your provider. They cannot give you those results until the provider or the nurse has talked to you. So they have to go into the chart. They have to make sure that's been done. So don't call HIM until after you hear from your provider or nurse to get those results. We just really appreciate any help on this. The other thing that I wanted to go over is we know that people have tested COVID positive in the community, and we had a plea the other day from LifeServe about people that have tested COVID positive, if they could give convalescent plasma donations. And so what is convalescent plasma? Plasma is really the yellow liquid part of the blood that contains the antibodies. And you've all heard about we have antibodies if you've been COVID positive. Antibodies are protein that made by the body in response to infections. Convalescent plasma is plasma from patients who have already recovered from COVID-19 and may contain the antibodies against COVID-19. For people who fought and recovered from COVID-19, their plasma now contains COVID-19 antibodies. These antibodies provide a way for the immune system to fight the virus. So those who have recovered from COVID-19 have plasma may be able to be used to help others fight off the disease. So they're asking that those that have had COVID-19 try to help others. And I've heard a lot of in the community saying, how can we help? What can we do? So if you've had COVID-19, this is something you guys can do. So who is eligible? People who have fully recovered for at least 2 weeks are encouraged to consider donating plasma, which may help save the lives of other patients. Individuals must have a complete resolution of symptoms for at least 14 days prior to donation. COVID-19 convalescent plasma must only be collected from recovered individuals if they are eligible to donate blood. Individuals must have had a prior diagnosis of COVID-19 documented by a laboratory test and meet other donor qualifications, and they'll help you go through that. when you call. A negative lab test for active COVID-19 disease is not necessary to qualify for donation. Because as we've said before, even though you're not shedding the virus or giving the virus or infected, can infect anybody else, you still may test positive for the disease. And so even if you do that, you can still give for this. What is the process for donating plasma? It's similar to donating blood. Plasma collection is done through the LifeServe Blood Center, and that's in Sioux City. The provider of the blood to more than 120 hospitals across Iowa, Nebraska, and South Dakota. They supply our blood. They supply much of the blood throughout the region. Potential donors can schedule an appointment or seek more information at www.lifeservebloodcenter.org or by calling 800-287-4903. Why donate? Donating with LifeServe Blood Center is the only way in our community to help current COVID-19 hospital patients and people. We are running out of convalescent plasma. So I just wanted to let people know that is a way they can help. All right, thanks everybody for watching today. We appreciate it.
Thanks, Laura. So just to note, our next community update will be 2 weeks from today, Thursday, December 3rd at 7 p.m. And if you stay tuned, we will do our question and answer segment at the end of everyone's updates. And you can email those questions to covid@winnebagotribe.com. Next up, we will go to Dan Farringer with Winnebago Public Schools. Dan?
Good afternoon, everyone. First of all, I want to start with some data from the school as to maybe dispel some rumors out there that everybody is positive. As of 11/19 today, WPS has had 13 known total positive tests for certified staff and 12 known positive tests for classified staff. We've had 5 certified staff and 13 classified staff in quarantine due to close contacts. A breakdown of when this happened is as follows. Out of the 13, 3 of them were in the summer months, 1 in August, 2 in September, and 7 in the months of October and November. Classified, 2 in the summer, 1 in August, 1 in September, and 3 in October and 4 in November. And I'm also working with Nurse Julie and Noreen to get some student data regarding the COVID numbers. When we say this, protocol is being followed and no staff members are in the building if he or she tests positive until the notice says he or she can return. We continue to keep the building and classrooms disinfected, wearing masks, using desk shields, using hand sanitizers, and social distancing when possible. Also, I would like to share basically what's been said before. It is vital that we take all the necessary steps to keep our teaching community healthy and able to teach. Please follow the recommended guidance from the governor and health department. Practice the 3 C's. Avoid crowded places, avoid close contact, avoid confined spaces, and also continue to follow the health safety measures of washing hands often, cleaning and sanitizing high-touch areas in your homes and classrooms, physical distancing when possible, wearing a mask, and consider whether your trips or activities out of town are necessary. Ensure that everyone in your household wears a mask every time you leave your house and go out into the public. Avoid large gatherings as much as possible, including gatherings with relatives if they do not live in your home. These are some of the things that will help keep us safe, as has been heard earlier. Also, next week, we will know more from the NSAA, as I believe they're going to visit with the Commissioner of Education to decide on the winter activities. I know Iowa's put some stipulations in, and not sure if we're going to follow that road or not, but that will come next week. Is supposed to be the meeting. Other than that, it's just imperative to stay, follow the safety measures and stay healthy. Thank you.
Thank you, Dan. Next up, we will go to Little Priest Tribal College updates with Manoj.
Good evening, community. Hope you and your family are doing well. As Mona mentioned, that with the cases surging, please heed extreme caution regarding the COVID-19 situation. A quick update from Little Priest Tribal College. As you all know, the spring 2021 registration is open. We are having some face-to-face class available next semester. We have hybrid, we have HiFlex, and we have online. So we have 4 different modalities of instructions next semester. I'm requesting all the students and parents or anybody who is interested to sign up for the classes. Please do so ASAP. There's no reason to wait till the last minute. Some of the classes have limited seats available, so it's first come, first served basis. We have a total of 4 cases at Little Priest Tribal College between March 16th and now. 3 have recovered, 1 is an active state, and that individual is doing well as well. We are bending backwards to make sure that we take precautions, sanitization to keep our employees safe. As mentioned by others, it is extremely important to keep social distancing in mind and wearing masks. We are very proud of our mask culture at our college. Everybody is wearing masks all the time, and if somebody forgets, we quickly remind them to wear the mask. I've been informed by many people that the vaccine is coming and we can, let our guard down. Well, that's the great news. The Moderna and the Pfizer vaccines are moving along with other companies, but please note the FDA has not approved it, and it's going to take us a long time to get those vaccines, and we also don't know the efficacy of the vaccines. So don't rely on the future promises and let your guards down. It's really, as a community, we need to come together now than ever before so that we protect our community. I want to wish everybody happy Thanksgiving and take care. And that's the update from Little Priest. Thank you.
Thank you very much. Next, we will go to HCI for an update with Sam.
Thank you, Emily, and good evening. I'd like to talk about a couple opportunities for tribal members. Ho-Chunk Inc.'s Ambassador Program is accepting applications. This part-time work is available to individuals living in the Winnebago and Omaha reservations. Ambassadors help support work in areas across the company and also the community. Several ambassadors had a big part in helping with the recent freezer distributions. There's good flexibility for this work. Many ambassadors are currently taking college classes, have other part-time jobs or family obligations. If you're interested in applying, please visit the Ho-Chunk Inc. website. You can also learn more by reaching Janelle Decora at the corporate office for more information. The second opportunity I wanted to talk about is our paid summer college internship program. The application and program details will be announced soon. So please encourage any college students you know to get ready to complete the application over winter break, and be sure to follow the Facebook page for Ho-Chunk Inc. community engagement. Those are my updates for today. Thank you for your time.
Thank you, Sam. And lastly, we will go over to Winnebago from an update with Mayan.
Good evening, Winnebago community. A couple updates from Winnebago Casino Resort. Last time we talked about we are going to start moving towards opening different areas. We're doing a survey with our guests as far as our smoking bans, fitness rooms, golf simulators, things like that, our pool. However, with the recent spike in the governor's proclamation, in addition to her guidelines, we have put that on pause. We are trying to protect our guests, our families, our friends, our team members. So that's not going to happen right away. We're going to still continue to monitor the area and the ongoing circumstances. So the other day, we implemented what the state has set forth as guidelines for restaurants and bars. All our restaurants and bars are closing at 10 p.m. Each evening, as well as no seating at the bars. That's our newest guidelines. We are going to work on potential smoking in and within the casino at some point, but right now, due to our guidelines in the state of Iowa, we're also not going to implement that due to the requirement of having masks on indoors, especially at Winnebago. Again, as you enter, we're going to continue to utilize our strict guidelines of taking your temperature, requiring a mask, it's mandatory. And then we also have throughout the whole property, hand sanitizers, disinfectant wipes to wipe down your machines and the areas. We also have pins for each person to take, so you don't have to use a pin that somebody else has used. And we want to ensure the 6-foot guidelines, social distancing. So please stay safe out there. Wash your hands, social distance, disinfect your hands, and keep your mask on. Thank you very much from Winnebago Casino Resort.
All right, so thank you, Mayan. And lastly, we will go to the question and answer section of today's update. We will start off, we did get 2 questions pertaining to communications, so I wanted to address those. One of the questions was in regards to the COVID-19 information and if it is sent to other methods other than Facebook. And did want to reiterate that yes, it is, and you can go to www.winnebagohealth.com and there are 2 different pages on the health department and the hospital websites that contain all of our COVID information and our current dashboards that are updated daily. So check those out for information. We do send out as well COVID updates via the Win News. We update our community posters boards as well, and then hand out some flyers with our CHRs and with our senior meals. So if anybody has any questions in regards to that, you can email covid@winnebagotribe.com and we can address those. Next is the questions about weekly updates. We are right now doing bi-weekly updates. We did survey the community and most of the feedback we got was that they wanted bi-weekly updates, and then we do post as often as we need to on all of our pages. So make sure to like both the Winnebago Public Health Department and 12 Clinton Unity Hospital Facebook pages for more frequent updates. All right, so we'll go into the first question. What is the health department, or is the health department playing down the virus? Is it the worst it's ever been? Mona, can you address that?
So I apologize if it seems like we're downplaying it, but we have been conveying the same message for 9 months but it's really up to personal responsibility and your actions. So community members need to wear their mask, and if someone is not wearing a mask, then they need to get away from that person. Anyone that's not in your household, then you should treat them as if they're positive. The surge in cases are very concerning, especially with the hospital capacity. So as you are making your choices, remember what Laura had indicated about the ambulances and finding beds for people. I think we're all mindful of the news around us. And so we just need to heed that advice and make our own decisions.
Thanks, Mona. The next question is, other tribes have their reservations plastered with native design mask mandate posters. Why hasn't the Winnebago tribe done anything like this? Tori, can you answer that one?
Thank you for the question, and that's a great suggestion. I've reached out and had a small discussion with the communications manager, and we talked about providing some culturally relevant signage and where we could continue to provide education through some of those mixed media platforms and incorporating our culture so that it's not only appropriate for our community, but it's also using our local tribal members and some of the photos that we have from various community events. So thank you for that suggestion. We'll work towards that.
Great. Thank you, Chairwoman. Next, we will go to back to Mona. The question is tracing COVID here in Winnebago, has it been tracked to any business or department? Is it possible to say we trace this back to an event or gatherings in the updates? Mona, I know you addressed this, but do you want to reiterate that?
Sure, thank you. We're continuing to do contact tracing for all of the 215 cases that we have. And as the graph showed, the majority of our cases have been identified either within the household or been a close contact, and then followed very closely, not very closely, I guess almost half, by social activities and then family gatherings. And so that just indicates the different activities that our residents are partaking in.
Okay, thank you, Mona. Next question is about the food and the food for community members. It asks about if there's a possibility for food vouchers. Some community members are worried about the lines getting longer. So Tori, can you address that?
Yes. So the question is about, and has continued to be on social media as well, if there would be food vouchers distributed to tribal members that are living off the reservation, is most of the feedback that I saw. And at this time, the pandemic task force or the council has not made any type of allocation or determination that they would be providing food vouchers. But I'd also like to take this opportunity to talk a little bit about the types of funding that the tribe has received and some of the limitations with those funds. There's CARES Act funding that was distributed by the Department of Treasury. And one of the things that I shared with the council and with some individual tribal members is that it wasn't the tribe's formula that determined what we would receive. And many tribes advocated for the IHS distribution formula because that was tied to a formula that the tribes had been consulted with, had approved, and thought was a fair distribution. Well, the Department of Treasury, in their wisdom, came up with their own formula, and they used one of the biggest barriers that they used for us was the Indian Housing Block Grant numbers, and that's based on census data on the reservation. And as you may know, we have a difficult time trying to get a true census of our community by the responsiveness to that census data. And it hurts us in other occasions when it comes down to funding because we don't have the true number of individuals that should have been counted in that census. And so with the Department of Treasury using that as a basis of their in their formula of distribution, that not only shortchanged us in a way that we feel the census is underreported, but also that every single tribal member that's enrolled with this tribe was not counted. And if it was up to the tribal council, we would have wanted our entire tribe counted so that we would have resources and be able to provide those resources with the met need and the unmet need of our tribal members. And that's just not what happened. And so the tribal council and the task force tried to do the best they could to make the most robust use of those resources. And it hopefully would be used for some long-term infrastructure improvements and things that would help prevent the spread of COVID. So that's a very long-winded answer of why maybe some things that the membership, particularly away from the reservation, have not been able to participate in, or that there hasn't been enough resources to have that far of reach. And I will, as I committed to one tribal member I emailed with, that I will continue to have these conversations with the council on how we can try to meet that unmet need and not think that you're just forgotten about. So, thank you.
Thank you, Chairwoman Victoria. The next question is about the rising cases here and on the Omaha Reservation. It's directed towards Laura for the hospital. The question is about us getting overwhelmed. What are we doing to help each other out, and what's the contingency plan?
Sorry, I'm on mute. Yeah, so as I talked in the slides, you know, there is a potential to become overwhelmed if we don't follow the things that we went over today. Right now, we are doing okay. We've had some influx in the AED, and we are ready to take COVID patients if we need to. And if they can stay at our facility, or if we can't get them transferred, we do have contingencies plans to take care of those patients. We try to take care of whoever comes to our facility and take care of them in the most appropriate way that we can. And so we are ready. We have been working with Carl T. Curtis, and we've been trying to meet with each other on a weekly basis to kind of see where they're at and where we're at, and help each other out if we can. And I think it's been a very good relationship, and we continue to grow that relationship because we want to help each other out.
Great, thank you, Laura. The next question is in regard to the length of quarantine. So they want to know why some people must quarantine for different times. Sometimes it's 7, 10, or 14 days. Mona, can you explain that?
Sure. Thank you. I know it's kind of confusing, especially for quarantine and isolation. So, for example, I guess if someone, let's start with the positive. So if many of them do not come in the very first day that they're experiencing symptoms. So sometimes it's a couple of days later, but we start their isolation date with that first day that they start having symptoms. So if you started on the 1st, then you don't get out on the 10th, but you may have tested on the 3rd. So it appears like it's only been 7 days kind of thing, but it's really been 10 since your symptoms. Now, usually the 14 days would be our quarantine individuals. So it is 14 days from the last day that someone was encountered or exposed to someone that was positive. So when they live in your household, it's a little bit different because we have to wait for the last positive person to be done with their isolation. So unfortunately, people that don't have any symptoms that are negative, they could be waiting quite a length of time in order to actually get out of quarantine. Especially with our family structures, we have a lot of family members inside our households. So if we have a family of 6 and only 2 of them are positive, but they're at different times, it could really lengthen the amount of time that the family stays in quarantine. So every individual is different, but as soon as they're released, especially from isolation, is always sooner than those that are in quarantine. So I know it's confusing, but every case is different.
And I think one thing to add, this is Laura, if you don't have symptoms and you tested positive, then we go with the date you tested. So then you kind of, if you have symptoms, if you don't have symptoms, it could be different.
Got it. Thank you, Mona and Laura. And I also think that's important why you have been reiterating if people don't feel good or have sick or have symptoms to stay home so that that doesn't spread as well. Okay, next, and this is the last question as well. What's the hospital status on oxygen monitors? Laura, can you comment on that?
Yeah, so we can send oxygen home with you. You know, we have a company that'll come out and set oxygen up in your home. We have case management that will help with that. So if the provider or physician or your mid-level thinks that you need oxygen at home, we can get that set up for you. It may be the case that you might need to be in the hospital for a little bit for oxygen, but there are some people going home with oxygen if they have mild symptoms, just need a little bit of oxygen when they're up and moving around. So we do have the capability of doing that. And we have done it. Maybe we haven't done it a lot, but we can do that.
Okay, thank you, Laura. And we do have one more question. I missed one. So this is for the tribe. It is asked about the deep cleaning schedule for all of the tribal buildings, and if there is one, and if things are being cleaned every night. So Victoria, can you comment on that?
Sure. We did check with the physical resources director, and she assured us that there are weekly cleanings being taken place, and the individual programs and building managers have to schedule that weekly cleaning with facilities. The reason why they aren't being done on the nightly basis is because of the exposure of the chemicals. And for that matter, they're scheduled on the weekly basis. So I would encourage any department heads to work with our facilities department to get on that schedule to ensure the safety of the building and the security of the individuals who are not only consumers in those buildings or services, but also for the employees. So thank you for that question.
Great. Well, thank you all so much. That concludes today's community update. As a reminder, our next one will be Thursday, December 3rd at 7 p.m. And you can email your questions to covid@winnebagotribe.com and we will answer them in our next update. Thank you all, and we wish everyone a safe and healthy Thanksgiving. Bye.
Thank you.
Thank you, everyone.